I'm Ashley LaRoche from the Animal Hospital of Statesville. I'm with my handy dandy assistant Kyle, and we are back for one of our Lakeside Chats. So we're going to have an interesting subject today, a little different than some of the other things we've talked about, but what is the #1 dog breed in America right now?
Besides Doodles?
Besides Doodles.
Well, my prediction is this dog may be mixed with Doodle eventually.
Yeah, right.
But right now it's Frenchie.
Yes,
French Bulldog.
The French Bulldog. So the French Bulldog is an example of what we call a brachycephalic breed. Brachy means small, cephalic means head. So basically these are the dogs that have the really smashed in nose. They are bred like this, and unfortunately we've bred an abnormal airway and how that they breathe. So these dogs have a really narrow nose, so the opening to their nose is very, very narrow. They have a smaller than normal trachea most of the time, and then they have a soft palate, or the roof of your mouth is a little too long into the back of the throat, and so what happens is it can entrap your epiglottis, which is the opening to your airway, and so they have lots of breathing issues. And the sum of all of these things is they call it BOAS if you've seen it. It's Brachycephalic Obstructive Airway syndrome. So we're here to talk a little bit about that.
Okay, what other dogs would be affected by this besides the Frenchies?
You're looking at the Pug, the Boston Terrier, English Bulldog, of course, is probably a #1. Mm-hmm. And some Pekingese can be that way too.
Yeah.
So,
is this the cause of at least the elongated palate, is that the cause of those, what we call reverse sneezes and stuff like that? Is that the same thing?
It's not exactly the same thing. I think it can lead to that, but reverse sneezing is just inflammation in the back of the throat. So basically these dogs do a lot of snoring, snorting, those sorts of things. They have extremely loud breathing, and that's not normal. So, and it's because of the sum of all of these abnormalities.
So these dogs, as you said, are affected more by heat, or by the heat and humidity and such. Why does that bother them? I mean,
right. So basically a dog releases heat primarily through panting. They only have eccrine or regular sweat glands like we have on their pads and on their nose. So it doesn't effectively get rid of heat quite like it does for us, because there's just not enough of them. So basically they pant. Well, the brachycephalic breeds cannot pant effectively. They don't move enough air, so they retain heat quickly. And so owners need to be aware of that, basically taking them out in the morning when it's cool, evening when it's cool. When you do take them out, really short stints, bring them in, make sure they have lots of fresh, cool water, those sorts of things.
Keep them cool.
Yeah.
Don't leave them in a car or anything like that. Of course, you shouldn't leave any dog in a car, but especially them. So it says that they can be more debilitated by respiratory disease as well?
Yeah, so respiratory infections, basically these dogs have a compromised airway already. So when they get infections and start coughing and inflammation, it's just accelerated 10 times. It's like a human that has COPD and ends up with influenza. They're more severely affected by some of these respiratory viruses, bacteria, whatever. So
what happens if they do get that and they're so affected that they can't breathe? How do you solve that?
Right. So a lot of these dogs will need oxygen. They are so prone for basically respiratory crisis anyway. Just any sudden need for oxygen, whether that's excitement, exercise, or they're sick from respiratory disease. Sometimes they have to be kept in oxygen. Sometimes they need intubation if they're in severe crisis, which means stick a tube down the throat. Sometimes they need temporary or permanent tracheostomies.
And that's the hole in the trachea.
Hole in the trachea to bypass the upper airway. And then unfortunately some of them can die, and that's unfortunate reality.
So says the longer the dog goes on with the poor airflow, the more chronic changes happen.
So when you breathe poorly for a long period of time, basically you have this increased pressure, you start developing some secondary changes that necessarily you can't fix. So they start developing excess tissue in their throat. That basically closes that airway even more. They can develop what are called everted saccules, which are like little pieces of the airway that kind of pop up and proptose that occlude airflow. They can even have laryngeal collapse, so the larynx kind of starts to collapse. These aren't necessarily all fixable types of things, so that kind of heralds a worse prognosis. And doing certain corrective surgeries, it may be a bit too late to help those guys when they reach some of it.
So when do you want to do, I mean, what can you do? There's a surgery to do to take care of that, or at least help, right?
Sure, there are surgeries. So what we can do is rhinoplasty, it's called. So we
nose job.
Yeah, nose job. So we take a wedge out of each nostril and open that airway up to make that, to make that airway look more like a normal dog. So it's like a permanent breathe right strip for these dogs. Typically, we're going to do these corrective surgeries when they're young because they don't have those chronic changes that really aren't fixable.
So spays and neuters, good time to do that?
Perfect time.
And do you see these issues when they're born? Do you see them early on? So it's something that you know?
Oh, you can see them as they're developing pretty young, yeah. But you can't correct them too early because they're not, as young puppies aren't good anesthesia candidates.
Right.
So you got to let the airway develop and then make sure they're a good anesthesia candidate. When we do the spay and neuter, we're intubating them. We do that with everything, so we can really examine that palate at that time. Is the soft palate too long? Sometimes it is, sometimes it isn't. Well, we would basically take our cutting laser and trim it back to a normal sized dog. So we're trying to more normalize, it's never normal, but we're trying to more normalize airflow in the dog so they have a more quiet laminar flow so they don't get as many of these chronic changes. Because once the older they are, the higher risk they are for this respiratory crisis. These dogs don't do as well with surgery, when they get older because they're chronic changes.
Just when you intubate them for surgery, you have to leave that tube in a lot longer than you do with any other kind of dog because they have that breathing issue, and you want to make sure that they wake up okay.
And they may not have the most sensitive tracheal area and things like that. So I think they don't even really feel that tube there, a lot of times. So it's interesting.
Well, when let's say you go to a breeder and you look at these dogs, is there a way for people to see something that they ought to be aware of? Because that can be a really serious problem.
Well, and I think it's pretty ubiquitous in the French Bulldogs, but you can see that nose. I've not seen too many French Bulldogs that had a normal nasal anatomy. So I think when you're getting these breeds, we need to, hopefully, over time here, we can do some more healthy breathing to elongate the nose and correct some of these things, but that takes generations and generations and generations. So, when you purchase these breeds, just being aware that these are breeds that are probably going to need corrective surgery pretty early on and are just going to require some little more maintenance and
caution.
Diligence. Yeah, and be aware of that. The Frenchies, they also get some spinal issues and things like that, owners probably should do your breed research, before purchasing these guys.
Yeah, be aware, and that's with any dog, is to do your research and see if these are issues you think you can afford to deal with, want to deal with, and want to put a dog through, basically.
Yeah.
What was I going to ask? Oh darn. See, this is what happens when you add extra questions, and then you lose your chain of thought, whatever.
Well, some of these guys also are prone to, aspiration pneumonia and, esophageal reflux. Just it all is secondary to just breathing badly for periods of time.
Now, if you repair that, does that eliminate those issues, or just
it manages them better? It manages them. The physical construction of their nose and airway, you can't fix that, so you just do your best to help them as much as possible, increase their quality of life. And if you increase that airflow, you hopefully will have a few less problems later on. They'll have a better quality of life for longer and may not get those chronic changes. So.
With rhinoplasty and fixing that elongated palate, how long is the recovery time for that? Is it about equal to if they're getting spayed and neutered, about the same thing?
Sure. So post-op with the nasal, with the rhinoplasty, so they have some dissolvable sutures in there that you don't really need to worry about. The palate, you need to keep these dogs really quiet, just because they've got, basically we've cut a piece of tissue out, it's healing, it gets inflamed. So transiently, these dogs may be way more prone to things like aspiration pneumonia and a respiratory crisis because they're healing up. And so basically their airway was compromised. I transiently added some inflammation to it. They'll be way more better off later on, but they do need to be managed and kept quiet. So we don't want to start vomiting or reverse sneezing jag, and those can be real complicated things for this breed of dog. So,
well, in lieu of surgery, can people give dogs medication to help this out, or
no, not
pretty
really.
much surgery is the option?
Pretty much, yeah. They're pretty much surgical, and we evaluate, pretty much every Frenchie and talk to owners about those things when they're puppies. So, and the breeding dogs. We're probably going to recommend at least going in there when they're young, because they're probably not going to be neutered. But for the most part, it's when they're spayed and neutered. So, and if they're having severe problems while they're really, really young, the question is, should we be breeding that? I don't know. So.
Well, and I think that's when you take the advice of your veterinarian to say, this is probably not a good candidate. I'm not sure everybody does that, but that's I think that's the answer to this question or this issue, is to breed it out of them, just like any other
just
genetic
breed
condition.
for a little bit longer nose. That's all they need,
They'll still be cute.
Just to have a muzzle. Yeah.
Well, maybe once they become Frenchie doodles, they'll they'll have that taken care of. What do you think?
Yeah, I don't know.
Maybe.
Hopefully.
How do you know? Make sure he gets the Frenchie nose or the poodle nose instead of the Frenchie nose.
The hair will be interesting. Yeah.
Anyway, so that is our Lakeside Talk for this month, and it's been really hot, and some of us have been on vacation, so we'll probably continue that next month, and we'll have another interesting topic for you to learn about.
And we look forward to seeing your Frenchies and Bulldogs. And as an aside, obesity really contributes immensely to this issue, and particularly with the English Bulldogs, all your dogs should have a waist.
Yes, and we see a lot of overweight Frenchies and Bulldogs.
Yeah, we do. And that
and Pugs
makes things much, much worse. So
so keep them skinny, get their noses fixed, take good care of them, and love them. Like crazy.
Yep, absolutely.
They're sweet dogs. So.
Yeah, they are. They're hysterical, actually. So we'll see you next month. Bye.
Bye.